Good morning. I'm Mark Malloy. I'm the medical staff representative on the Infection Control Committee at ACMC, and just wanted to catch everybody up with where we are. The hospital and its various committees have been working for the past month dealing with the COVID-19 pandemic. We have set into motion many things to keep our staff and the public safe. We are doing as much as we possibly can to mitigate the number of cases locally, and I'll tell you about that in a minute or so. But right now, if you think you have symptoms, the best thing to do is to call your PCP. Our office is set up now to screen you over the phone. If you are sick enough to go to the hospital, we will be able to tell you that. We can do the testing here in the clinic, and we will try to keep everyone at distance while they're in the clinic and in the hospital. This is for your safety. The rules are not to take away your freedom, is to keep you and everyone around you safe. We will do the screen. If you're not sick enough to be in the hospital, we will ask you to go home and quarantine until we get your test back. Pretty simple procedure. As everyone knows, the testing kits are in short supply, and it is taking us a while to get our tests back. The good news is there are no positive in the county. Please do not let your guard down. Continue to distance yourself. Stay out of crowds. Do not go to church during these times. There'll be time to go to church later on. Wash your hands. Don't cough on anybody, and do not let anybody cough on you. Disinfect surfaces that you touch every day. Handles on refrigerators, doorknobs, tabletops, countertops. I cannot stress this enough to keep down the number of cases as low as possible. When you look at worst case scenarios, the vast majority of the population will at some point become infected. We think probably 80%. Of that 80%, fortunately, most people will not have symptoms or have very mild symptoms. Unfortunately, that's the population that is going to spread it more rapidly than the ones who are symptomatic. Unfortunately also is that if you're asymptomatic and you give it to someone who has other medical problems, who are in an older age group, you have just infected someone that could get seriously ill or could die. If there are enough of these patients that have to be in the hospital, we may get to the point where some people that need scarce resources will not be able to get those. And we are not sure that if we do not have enough resources here, we cannot be sure that we can send you to another hospital. As of right now, we are following the CDC guidelines and the Arkansas Department of Health guidelines on who should be screened, who should be tested, how long they should be quarantined. If you're tested and asked to quarantine yourself at home, please do that. Every time you come outside your home, you may be endangering someone else. And again, the doctors, the nurses, and the hospital staff are all working diligently to keep you as safe as possible. Be safe and take care of yourself and take care of the community.